And for this Thursday, June 24th, we go to the Zoom connection today to be joined by Sara Donkersloot. Good morning, Sara.
Good morning, Gary, and welcome to Wellspring, a live broadcast sponsored by Spectrum Health-Zeeland Community Hospital. And as Gary said, Derel Glashower from the Ottawa County Health Department. He is the senior epidemiologist. That's quite a title, Derel. We are joining by Zoom, and Derel is going to provide an overview of the state of COVID in our county. Good morning, Derel.
Hey, good morning, Sara.
It's a delight to have you on. So, epidemiologist, that's a big word. Tell us what an epidemiologist does.
You bet. So through the COVID pandemic, I'm sure more people have heard the title epidemiologist. So I think there's more and more people who are aware of what an epidemiologist does. But just the short version is that epidemiologists are typically disease detectives. They are chasing after diseases in our community with the goal of preventing them. Our job is to find where there's extra risk, where there are populations that are more affected so that we can target our resources for prevention in a cost-effective and a way that just gives us the most bang for our buck.
So how many epidemiologists are at the Ottawa County Health Department?
So here at Ottawa County, we have 3 epidemiologists. We work on a number of things, including COVID-19, other communicable diseases, and some of the tougher topics like suicide and overdose, just because those are all important topics in our community. But we also get to do things like community-wide surveys, the youth assessment survey, or a community health needs assessment that involves collecting data from adults across the county. So we wear lots of hats.
So I guess that I can have you on for something else to talk about at some point other than COVID, Derel.
And be welcome.
Wonderful. So Derel, what a year it has been. You know, this morning we want to take advantage of your expertise and get a glimpse of how COVID has impacted our community and county. So how many cases have there been in Ottawa County since it began?
So if we look back to March of 2020, since then, we've had over 33,000 or almost 33,000 cases here in Ottawa County. So if you think about that from our population perspective, that's about 1 in every 10 people that's been a countable case of COVID-19. So it's had a tremendous impact on our community. You know, many people, they got sick, they recovered, but there's a handful that passed away or that suffered other complications or poor outcomes that may have involved hospitalization.
So, you know, when COVID started, we saw that it was the older population. So give us an idea, how do those cases break down by age?
That's a good question. There have been different times during the pandemic where it may have affected different age groups. Some examples are when schools and universities started back in September. We saw more cases in that school-aged age group. And if we look at the data overall, going back to March of 2020, the proportion of cases is highest in those younger age groups, 20 to 29, and even those that are out and working. So in the 30 to 39 age groups. So if we're looking at just the overall cases, it's usually the middle-aged, younger age group. But when we look at the cases that suffered the poor outcomes like higher rates of death and higher rates of hospitalization, those were definitely the older age groups, 60 plus, and especially those that were 70, 80 plus, suffered some of those, more of those poor outcomes than other demographics in our population.
So, you know, when you talk about, you talked about the older, now, in the last surge, we've had the younger. How many deaths in the county when we talk about 33,000, plus people?
Of the deaths that we've recorded just over 400 deaths among Ottawa County residents. So that's about 1.3% or so of all of the cases that we've had have resulted in some sort of mortality. And a lot of those are occurring in our older folks. And I think that's, one of the reasons to really be thinking about vaccination and its benefit on preventing hospitalization and death. The head of the CDC just said recently that of all of the COVID deaths that we've seen, now many or most of them should be preventable because of the protective power of the vaccine.
Yeah, and those 400 people, their loved ones, their people are feeling that emptiness in their family. So let's switch to the effort to get people vaccinated. We talk about herd immunity. First, why don't you explain what is herd immunity and why is that so important?
I think that when we talk about herd immunity, many of us think it's a very static number that once we hit it, suddenly everything's going to be fine. And I think that the reality is that herd immunity is probably a changing number depending on where you are in the world or where we are in time, just because COVID-19 also mutates and changes, and some of the basic characteristics may change. So herd immunity, generally, we have a target of 70%, trying to get 70% of our population vaccinated against COVID-19. And generally, we think that range, hopefully, we have more people in the population vaccinated than that range will protect unvaccinated people from even being exposed to COVID-19. Meaning that if COVID-19 brushes up against our population, it doesn't have the power to move through the population, but kind of bounces off the wall of immunity that the herd immunity has given us.
So when we talk about that magic number 70, how are we doing as a county, and then how are we doing as a state?
That's a really good question. So, here in Ottawa County and across the United States, there's only a certain portion of the population that's eligible for vaccination. So people aged 12 and up. And those kids 11 and under are also still part of the herd. So ideally in the future, we have a safe, effective vaccine that's can be used for kids that are younger than the age of 12, so that we can boost that herd immunity even more. But when we look at those that are eligible in Ottawa County right now for vaccination, almost 58% of them have received at least one vaccination. So we are continually marching toward that goal of 70%. And I think that, with time, I think that we can achieve that goal.
So let's talk about the vaccine. How effective is it? You mentioned that earlier when we were talking about herd immunity. If 70% of the people are vaccinated, people are unvaccinated, it's going to bounce off. But talk about the effectiveness of the vaccine.
You bet. So the vaccine and its effectiveness are probably going to be a little bit different in different populations, but some of the best data that we have indicates that it's over 90% effective at preventing someone from getting a symptomatic illness. And then when we dive down even deeper and think about, does it prevent hospitalization? And it does. It can prevent people from being hospitalized. And that is a remarkable thing, because hospitalization costs a lot of money. It has a big impact on our population. And then also, if you do get sick, which is going to be a rare occurrence, your disease may be milder. Some of the data that we have indicates that you'll be less likely to get a fever, and you'll be less likely to have a prolonged illness. So it may shorten an illness up to 2 days. So there's all those other benefits to be thinking about, aside from just the shield of protection it offers you.
Okay, so we're talking, about, you said 50, well, I can't remember, 59%, around there, older population. But now with the Pfizer vaccine, 12 and up, how are we doing in that age population in terms of getting vaccinated?
That age group was made eligible for vaccine a little later in the cycle. So those that were age 16 and up were eligible already at the very, very end of 2020. And those that are 12 to 15 weren't eligible until later in 2021. So they haven't had as much time to get vaccinated, but their numbers are still encouraging. So they're approaching 30% of kids in that age range, 12 to 15, having at least one vaccine in their arm. So I think that's something to celebrate, and I look forward to seeing those numbers continue to rise through the summer. And my hope is that they get even higher as we approach the school year, just because that's when people get back together. Kids are back in school. It's a congregate setting that may make it easier to spread COVID.
Several months ago, the focus was to get people vaccinated at clinics. Now the Ottawa County Department is looking at going to events and other pop-up locations. Talk about that shift.
It's a big shift. There was a time there where in Ottawa County and our hospital partners and other counties in the region had these enormous clinics where we would give thousands of vaccinations every day. And we moved away from that just because demand has gone down, but also there are some logistical changes that have been put in place where pharmacies and doctors' offices can hold vaccine safely for longer periods of time in a regular refrigerator, making it easier for people to come into a doctor's office or a pharmacy and get a vaccine. So demand is down a little bit, but also it's much easier for our usual healthcare infrastructure to give vaccine. And so the pop-up clinics that we are shifting toward are more of a targeted approach. So instead of the large clinics, we are focusing on specific populations and places where we can meet the people. So farmers markets, going to apartment complexes, sometimes places of worship in churches are just some examples of where we will send a small group out to vaccinate just a handful of people, because every vaccine counts.
So, we're talking about vaccines. Want to ask you the question, do you have any inside knowledge about whether the vaccine is going to be offered, or how are we coming on progress for 12 and under?
I think that's a really good question, because like we talked about, the 12 and under are part of the herd. And so we want to make sure that if vaccine is safe and effective in that population, that it could at least be offered, and parents can make the choice about getting their kids vaccinated. There is an entire system for vaccine testing, safety, and approval in the United States, and that it takes a process that takes time. What we can say is what we've heard from the FDA and from our partners in the pharmaceutical industry is that we may have good data and the possibility of an application for approval in September or sometime this fall for that upper age group that are younger than 10, so maybe like 6 to 11. We may have some sort of information as early as September, and for that younger age group a little bit later in the fall. So it may come in sort of chunks, but we anticipate at least some closure in this fall.
Well, and that offers hope. On Tuesday, Michigan ended its mandatory COVID-19 mask rule and physical distancing requirement. What does it mean for restaurants and gyms?
It means a lot for them. Right now, there is no legal mandate for capacity limits or masking in either of those settings, restaurants or gyms. I think there's one takeaway that I really want to make sure people are aware of, is that just because there's not a mandate by the Michigan Department of Health and Human Services doesn't mean that individual businesses and employers, schools, and athletic organizations can make their own policies. So keep your mask handy in your car or on your wrist, because depending on what business you're going to, what store you're going to, they may have different rules. It will be a patchwork, but just know that there's not an overall state mandate, particularly for restaurants or gyms.
What about people that have not been vaccinated? Should they and do they need to continue to wear masks?
To the best of my knowledge, there's not a legal mandate by the Michigan Department of Health and Human Services for unvaccinated persons to wear a mask. It may be different. Again, check with your employer or make sure you're aware of the policies of the stores that you intend to visit.
We're about out of time, Derel. We got about 3 minutes left, but I want to have you address this issue. Michigan has confirmed 25 cases of COVID-19's highly contagious Delta variant. Can you educate us on this variant? And then will the vaccine prevent people from the variant?
Those are all good questions. So first, the Delta variant, there's been a lot of changes to the names of different variants for COVID-19. In the past, you've heard numbers and letters all jumbled up, and now we've moved to hopefully a slightly simpler system. The Delta variant is the strain that was circulating in India. So if you look back 6 weeks, you saw all these sort of horrifying images of oxygen shortages, ambulances lined up outside of hospitals, and sort of pop-up crematoriums in local parks and open spaces just because of the sheer volume of deaths. And so they were facing the Delta variant. Now, the Delta variant has moved across the world and is now supplanting the Alpha variant in Great Britain. And we've used sort of Great Britain as the sort of canary in the coal mine for what may be coming to the United States. So we anticipate that the Delta variant will be increasing here in the United States and here in Michigan. I think we can count on it. It is more transmissible. It can have more detrimental effects, so potentially higher hospitalization rates. And some of our therapies, like our antibody therapies, may not be as effective. So if you get hospitalized for it, the tools we have to fight the illness may be less effective. The good news is that although the vaccine is slightly less effective against the Delta variant, the data we have out of Scotland indicates that it's still 79% effective at preventing infection due to the Delta variant. So there's still a lot of hope. We just don't know what the coming months will bring for the United States and for Michigan.
My last question will be this, Derel. Some people that are listening out there say, I'm not vaccinated. First of all, I didn't feel it was rushed to production. It was new. Other people may say, I won't get hospitalized. I can make it through. What would you say if someone is listening out there and they haven't been vaccinated? Why should they get vaccinated?
I'd say first get vaccinated for yourself. Some people have different reasons for why they've made the decision not to get vaccinated. Like Sara just mentioned, that things went a little bit faster for the COVID vaccine than for other drugs and vaccinations. And a lot of that comes down to is money. There was just a lot of money behind the COVID-19 vaccine research and development that sped things up. Usually drug companies have to spread that over years just because it's not feasible. So hopefully that will, allay some of those fears. But number one, get vaccinated for yourself, because there is the risk for hospitalization, death, and just being away from work for 2 weeks, maybe more than what you can afford. And then lastly, get vaccinated for your community. Get vaccinated for the people around you to protect them so that you don't pass it along to a loved one who has an immunocompromising condition, or your kids, or anyone else in the community that can be really hurt by COVID. So help us be part of the wall that protects our community.
Derel, thank you for being here, and can't thank you enough for what you and your team have done during this COVID pandemic. And COVID is still out there, so the message is get vaccinated. If you want more information about COVID, you can go to the Ottawa County website, correct? There's lots of helpful information there. Until next week, Spectrum Health-Zeeland Community Hospital wishes you well.